Let's talk about a hidden world, one that exists inside most of us, whether we know it or not. I'm talking about the herpes virus family. Incredibly common, super complex, and honestly fascinating. We're going to break down what makes these viruses tick and why they're such successful lifelong companions. You know that feeling, right? That little tingle you get just before a cold sore decides to show up. Or maybe you remember getting chicken pox as a kid, all those itchy spots. Well, those aren't just random things that happen. They're actually our little glimpses into this huge family of viruses that have absolutely perfected the art of living with us. And when I say living with us, I really mean it. Get this. Somewhere between 60 and 95% of all adults on Earth are infected with at least one type of herpes virus. That is staggering. It makes them one of the most widespread infections on the entire planet. Okay, so to really understand how they're so successful, we've got to zoom in. We need to see how they're actually built. So what do these little architects of tiny troubles even look like? Every single herpes virus is built with this really clever 4-layer structure. Right at the heart of it, you've got the DNA core. That's the virus's entire genetic blueprint. Wrapped around that is the capsid, this super strong 20-sided protein shell. Think of it like an armored vehicle for the DNA. Then you have the tegumen, which is like an instant toolkit packed with all the proteins the virus needs to hijack our cells immediately. And finally, on the very outside, there's the envelope. And this part is genius. It's a fatty layer that the virus literally steals from our own cells, so it can walk around in a stolen disguise. But here's the twist. That stolen, fatty disguise, it's also the virus's greatest weakness. It's Achilles' heel. Because it's a lipid or a fat, it's easily broken down by the simplest things. Soap and water, alcohol, even just heat. So their most clever trick is also what makes them vulnerable to our most basic hygiene. So they're built smart, for sure. But their true genius, the thing that sets them apart, is their strategy. How do they manage to stick around, not just for a few days or weeks, but for our entire lives? Well, it's the strategy of the sleeping giant. A herpes virus basically has two modes of operation. First, there's the lytic infection. This is the all-out attack. The virus is actively copying itself, it bursts the host cell open, and it spreads. This is what causes the cold sores or blisters that we can actually see. But then, there's latency. This is the long game. The virus goes completely dormant, hiding out inside our nerve cells, where it's basically invisible to our immune system. And that's how it pulls off a lifelong hidden infection. This is all possible because of a special skill called neurovirulence. It's the virus's ability to invade our nervous system. So after that first infection, the virus literally travels up a sensory nerve to a cluster of nerve cells called a ganglion. For the cold sore virus, HSV-1, it usually retreats to the trigeminal ganglion, which is right up by your temple. And once it's there, it just goes to sleep. So what wakes the sleeping giant up? You can think of latency as a fragile truce between the virus and your body. But a lot of things can break that truce. You know, stuff like being under a lot of emotional or physical stress, getting a fever when you're sick, injuring that part of your body, or even just getting too much sun. Any of those can be the trigger that reactivates the virus, sending it right back down the nerve to cause trouble again. Now that we get their game plan, let's actually meet the family. Because herpes virus isn't just one thing. It's a huge, diverse group with some very famous and infamous members. The family is usually broken down into 3 main subfamilies. You've got the alpha viruses, like the ones that cause cold sores and chickenpox. They grow fast and they love to hide out in our neurons. Then you have the beta viruses. These guys grow much more slowly and hide in places like our glands. And finally, there are the gamma viruses, like Epstein-Barr virus or EBV. They hide in our immune system itself and are famous for causing mono. Okay, so if these things are total masters of hiding, how in the world do we even find them? And more importantly, what can we do about them? This brings us to the constant arms race of detection and defense. We've got a couple of tools in the toolbox. The old school way is to use a microscope. A doctor would take a sample from a sore and look for something called a Tsank cell. These are big, fused cells that are a dead giveaway for a herpes infection. The new school method, though, is PCR.
It's a super sensitive molecular test that can find the tiniest traces of the virus's DNA. It's become the gold standard, for sure.
So, once we find it, can we cure it? Can we get rid of it for good? And this is probably the most crucial thing to understand. The answer is no. The treatments we have today are all about management, not eradication. They work really well to stop the virus when it's active, but they can't touch the latent virus that's hiding out in the nerve cells. And this leads us to a really fascinating and kind of frustrating vaccine paradox. For VZV, the virus behind chickenpox and shingles, we have an awesome, effective vaccine. It works. But for HSV, the virus that causes cold sores and genital herpes, there's still no vaccine. And it's not for lack of trying. We're talking decades of research. Okay, so let's bring all this back down to earth. Why does a deep understanding of these viruses really matter in the day-to-day world? Well, we can get a really clear picture by taking the view from the dentist chair. The mouth is kind of a window into our overall health. A dentist might be the very first person to spot a clue that something bigger is going on. For instance, shingles can show up first as a bad pain in your mouth that feels exactly like a toothache, way before any rash appears. Or the Epstein-Barr virus can cause a white, fuzzy-looking patch on the tongue, which is often a major sign that the immune system is weak. Even HHV-8 can cause telltale purple spots in the mouth. And it's not just about what they can see in patients. For dental professionals themselves, there's a direct risk. If they get a tiny cut on their finger and it comes into contact with infected saliva, they can get a really painful herpes infection on their finger called herpetic whitlow. It's a serious occupational hazard. And that right there is exactly why the golden rule in healthcare is standard precautions. The idea is simple, but it's incredibly powerful. You have to treat every single patient as if they could be infectious. That means wearing gloves, masks, eye protection, and sterilizing absolutely everything. It's how you protect yourself and how you protect every other patient. When you step back and look at the big picture, you see this incredible ancient story. It's an ongoing arms race between our immune systems and these unbelievably adaptive viruses. It all leads to this huge central question. What does this relationship teach us about our own bodies, and what does it mean for the future of medicine? Are we just stuck managing these infections forever, or could we one day find a way to finally evict these permanent residents for good?